Mr. Evans, you're recognized.
Thank you, thank you, Mr. Chairman. Mr. Carson, post-acute care is very expensive in all of its forms. Those who receive it often have even more complex cases. Can you speak to that issue?
I'm sorry, could you repeat the question, please, sir?
Post-acute care is very expensive in all its forms. Those who receive it, it often has even more complex care. You speak to that?
Thank you. Yeah, there's a great deal of complexity, and Medicaid is an important provision that allows people to get to where they need to be. There's been discussion here about levels of care in different parts of the healthcare system for low-income folks or people who spend down to Medicaid eligibility levels. Medicaid is essential for providing the care that is needed, whether it be in a nursing facility at whatever level. It could be a more intensive type of care, the kind of care that's been referenced here. And it can also be the type of long-term assistance at home, for example, that individuals might need on an ongoing basis. Medicaid, working along with Medicare for many people, allows the basis to be covered, as it were, so the individual can get the medical care, the physician care, for example, or the hospital care that he or she needs, but also the long-term care that might be necessary as well.
Can you please elaborate further in how much even those enrolled in Medicare often still rely on Medicaid aid to meet their needs while in post-acute needs?
Thank you. As mentioned earlier, that the people who receive Medicaid-funded long-term care are 60% Medicare beneficiaries. So the programs are, in a practical matter for those people, the programs are set up to work together. It was mentioned, Medicare, oftentimes when people approach Medicare eligibility, they just assume, well, no, I'm covered, I'm 65. Medicare will cover me, but that's not true. It was mentioned for some of the other witnesses, even that Medicare won't cover a nursing facility care unless you have a qualifying 3-day stay in a hospital. There are various provisions like that that limit the ability of the Medicare program to meet the needs of real people, and specifically the post-acute, the topic of our conversation here today, in long-term service and supports. Medicaid is essential to fill that role because Medicare will not. And for older people and for other adults with disabilities, Medicaid is essential because it's the only program for those folks who are unable to pay privately that allows them to cover the long-term service and supports items that they need to live a full life.
Mr. Chairman, I'd like to thank you.